I think everybody's in now, in from the waiting room into the main room. So welcome everybody who's come to today's webinar, PPMA webinar. My name's Juliet Alban Metcalf, and I'm here because Real World Group, who I work for, sponsored the PPMA Award for Best Health and Wellbeing Initiative. And if you were at the awards, or if you've read about them in your emails, you'll have seen that the East of England Ambulance Service were the winners of the award, with their fantastic submission that they're going to tell everybody about today. So I'm absolutely delighted to welcome Debs Crelly and her colleagues at the East of England Ambulance Service, and she'll introduce everybody in a moment. They're going to take you through what it was that they did to achieve such great success in this area, so we can all learn from it. And those of you who aren't here present today will be obviously watching this from recording, so it'll be a great piece of archive for the PPMA as well. We're going to invite colleagues to talk for about half an hour, and at the end of the session there'll be an opportunity for Q&A. So we'll absolutely give you a chance to think about what you're interested in learning more from about for your organisations, and at the end of the session you'll have a chance to ask questions that you'd like to. So I'll hand over now to Debs.
Thanks so much, Juliet. I really appreciate that. So, as Juliet said, my name is Debs Crelly. I'm Head of Health and Wellbeing for East of England Ambulance Service, and we were thrilled to win the award with our Hapstar colleagues for our application, which is called Time for Me, and it's powered by Hapstar. An application like no other application, I have to say. Thank you, Dan. Can I have the next slide, please? We'd like to introduce ourselves first of all, if that's okay. So if I could invite Dan to come in. Can you come?
There you
Okay.
go. Sorry, I had the classic struggling to unmute myself at the start, but I managed. Yeah, so lovely to be here to speak to you all today, guys. My name's Dan, so I'm the head of partnerships at Hapstar. So we are the technology company that have partnered with East to build their Time for Me platform that we're going to talk through in a little bit more detail today.
Thanks, Dan. And Heather, can I invite you to come in?
Yeah, hi everyone. My name's Heather Adams. I'm the Health and Wellbeing Business Support Manager and the Suicide Prevention Project Lead for East of England Ambulance Service.
And Heather, by the way, also led on this project fantastically well. So thank you. Can I invite Lula to come in?
Absolutely. Thank you, Debs. Hi, everybody. I'm Lula. I am also from Hapstar. I'm the Customer Success Manager. So I've been working alongside Hev and Debs at East to help them with their customizations in the platform and also the data reporting of the wellbeing insights that we've collected.
Thanks, Lula. And this photo on here is actually the East team at the Emergency Services Show where we took the app as well. Next slide, please, Dan. So the dilemma that we had being an emergency service, but I think it's a dilemma that translates to any organisation within the UK at the moment, to be honest, is that we have a number of our staff who suffer from mental health issues, but also obviously health and well-being is holistic. It doesn't just mean that we support our workforce with occupational issues, but with any issue which is affecting their health and well-being, whether in or outside of work. Our amazing colleagues Mind, the charity Mind, did a survey back in 2019 about mental health issues in the ambulance service, where our people go. They really experience trauma. They go to traumatic calls such as RTCs, cardiac cases, pediatric cases, job after job with no time to decompress, and being measured on response times rather than clinical outcomes. All of those things affect people within the ambulance service, but we know that different things affect different people in different ways. Our dilemma is, how do we measure health and well-being? How do we know how well our people are doing in this challenging environment? And we know that today there are more and more people who are suffering symptoms of mental ill health. How do we support them? How do we target our support? Globally, over 70% of people experience trauma, so you don't just have to work for an emergency service. And about 15% of those go on to develop PTSD. In England, it's about 38% of females and 32% of males that experience PTSD. And at any given time, around 2.6 million people in the UK currently have PTSD. And an estimated 6.7 million could potentially go on to develop that. So currently having PTSD, that's about 4% of the population. That's not just people who work in emergency services. Thank you, Dan. Can I have the next slide, please? We are a big organisation. We are 6 counties wide. We're the size of Wales. And we are a 24/7 service. So how do we know how our people are doing when it might differ from county to county? One of our counties, Essex, for example, has a high cost of living, so our people suffer with financial well-being sometimes within Essex. Some of our counties, Norfolk, are more remote. We know that Norfolk has quite high levels, for example, of suicide ideation. So each of our areas can have different issues. How do we know what our people are suffering with within each of those counties? Also, our people work 24/7. We don't. We needed something that signposted our staff when they might be ruminating at midnight, sitting on their phone. How can we access those people to provide support at that time? We also, like any organisation, have people who find it difficult to speak to their manager. How can we provide a confidential way that people can talk to us and tell us what they need? This was the dilemma that we have. And I'll hand over now, I believe, to Dan. Is that right?
That's right, yeah. So what we did with the project of Time for Me was Hapstar and the East England Ambulance Service partnered to try and develop a solution to address some of those challenges that Debs was talking about. Now, Hapstar, we are a specialist mental health and wellbeing technology company, so we provide platforms and apps and solutions to support individuals in kind of proactively managing their mental health and wellbeing. And I think that was really important. We wanted to be a preventative resource to help people to understand the challenges that they're facing in both their career and their personal life in kind of real time, so we can provide the most appropriate and impactful support. So a solution that was available 24/7 was really important. People need to be able to access it wherever they might be. Obviously, Debs has kind of just spoken about the nature of being a frontline healthcare worker, right? Not necessarily always sitting at your desk and have access to a laptop. So it's the accessibility of Time for Me was really important. But it was also about building an environment and a space where staff at the trust felt confident and comfortable to go and seek support, knowing that it was private and it was safe and it was an avenue where they wouldn't feel discriminated against, and they could go and access support that was going to genuinely help them and make a positive impact on their mental health. And then also it was about empowering those individuals. So we want to give individuals the confidence to address their own challenges and to be proactive in doing that, and to be able to find the right support. So although probably the most crucial part of what we've developed was about supporting at-risk individuals and people that are potentially having or close to experiencing a mental health crisis, it was important that Hapstar and the Time for Me platform was for everyone. So you don't have to be necessarily struggling or feel low or have a mental health challenge. Time for Me is also about helping people to keep momentum and to focus on what's working and to build positive habits and to continue on that journey. Now, the final part, which is probably the most important, is if we do all of those things effectively and we have lots of staff at the East England Ambulance Service consistently engaging with Time for Me, going through the process, behind the scenes, we're collecting lots of fantastic anonymized data. So we can understand with Debs and Heather and the rest of the team at EEAST how their staff are engaging with the tools and resources, but most importantly, what are we learning about their mental health and well-being that we can use to then, one, to inform the project and to make sure we continually refine and improve Time for Me, but also so Debs and Heather and the team can make sure that their time and effort and budget are on the things that are most important to their people and the challenges and concerns that we're consistently seeing in the data. And Heather will go through some of that in a bit more detail in a moment. But just to give you a kind of whistle-stop tour of how Time for Me works. So it's an online platform, and it's also an app that's been developed for all staff and volunteers at the trust. So well over 6,000 people to have access to engage with tools and resources and content to help them to proactively manage their well-being. Now, there's a lot in Time for Me. It's been a collaborative project that's still ongoing, and we're consistently building on it and improving and refining what resources we put in front of staff at the ambulance service. But the most important part is the first part, which is about helping an individual to unlock their wellbeing profile. Now, what that means in the real world is we've developed a self-assessment that allows an individual to reflect on their well-being and how they feel, what's important to them, what's not important, where they feel positive and engaged, and most importantly, where they're perhaps struggling or need a little bit more support. So that initial assessment that we get staff to go through at the trust gets them to reflect on how they feel against the kind of 5 core pillars of their well-being. So how's their mental well-being, their physical health, their financial situation, how they feel about their social well-being, their friends and family, and then how they feel about work and their career and their well-being while at work. Now, the more our technology learns about that individual over a process and a period of time, against these pillars, the more we can then refine the support and make sure that the support and guidance and advice and how we triage people is always personalized for that individual and their unique experience. So to kind of give you an example of that, if we look at physical well-being, it's a huge topic, right? That means everything from your diet, do you get enough sleep, to are you working shift patterns, do you get enough exercise? There's so many different facets that underpin physical well-being, and that's the same for each of those pillars. So we really want to help individuals to eke out and understand what's important to them and where we can provide the most tailored and relevant support. And by doing that, we can then begin to understand that individual and use the platform and our technology as an early detection if a member of staff is at risk of key wellbeing challenges. So you can see here things like stress and burnout, anxiety, if they're at risk of loneliness or isolation, if they feel like they're working in a psychologically unsafe environment, how their resilience is. The idea is the platform will then detect if the individual is potentially at risk of some of these challenges and then can recommend the appropriate support. So if someone is already burnt out, we can be reactive and we can signpost to counselling and therapy services, to connecting with the wellbeing team, and lots of the fantastic resource that's available as part of the ambulance service. Hopefully, in most cases, we can spot individuals before they get to that point, and we can provide proactive support to help them step back and help them mitigate the bigger risk of that challenge. And that's always running behind the scenes for both individuals, but then we can also analyse that data at a team level as well. Everyone that goes through the Time for Me platform will be recommended a personalised action plan. So we'll tailor the resources that we put in front of people so they're specific to that individual and the challenges they're facing at the moment. So again, that could be anything from helping them to get a better night's sleep, to helping them to budget their finances more effectively, helping them deal with a challenge at work, any of those kind of wellbeing challenges we just looked at on the previous slide as well. But the idea is the platform will pull together kind of expert advice and guidance, but also bring in all of the fantastic initiatives that are already in place at the Ambulance Service Trust. The individual always feels like they're getting the right support based on their circumstances and based on how urgent that how urgent and prioritised that support is as well. And the final part is that we developed right at the start of this project, before we launched. We developed what we call an early warning system. So this is essentially like a safety net that sits underneath our technology to identify individuals that are particularly struggling. So if anyone is at crisis point, we can then triage them to the right help. Now, it's really important, as Deb said, it's a 24/7 service. So this needs to work 24/7. And if someone comes off a difficult shift at 2 in the morning, that there's the right and appropriate support that's available. And what this early warning system does is if someone is at crisis, they can then be triaged to various different channels, which can include the speak up function. So it allows them to actually get in touch with the health and wellbeing team at EEAST, and they can choose to reveal their identity and be connected with support. There's also lots of crisis lines and 24/7 helplines that are available as well. But yeah, Heather will go into this in a bit more detail, but we've had some, hopefully, it's always a small percentage, but when we do support those people that are at crisis and perhaps feel like there's nowhere to turn, that we can be that tool to provide that kind of wraparound support. And then the final bit for me, just before I pass to Heather to kind of look at some of the insight, is a really important part to the success of this project was making sure that the technology looked and felt like it was built for a member of staff at the East of England Ambulance Service. So at the very top level, that it's the right branding and colours and it aligns with the rest of the trust. But obviously, it's about going a kind of step further than that and making sure that we use the tool as a way to bring in all the different support avenues and resources and content that's already available as part of the wellbeing service at EEAST. So when an employee logs in to the platform, it looks like it was built for them. It's speaking the language of the trust and of being a frontline paramedic, and they can access all of the support that's available already as part of that service. So that's something we've done kind of step by step throughout this partnership, and it's something we always look to develop and improve. But you can see on screen here a list of some of the kind of initiatives that are bringing that to life. So yeah, I'll pass over to Heather, who's just going to walk through some of the data and impact that we've seen of the project so far.
Thanks, Dan. So I'm going to just talk to you a little bit about the data that we receive. So with our wonderful colleagues at Hapstar, they help us to generate a monthly report. This helps us to see which areas really need the help. So from those figures that we get through and from the areas of concern, we can drill down and support those areas. Now that can be on a one-to-one level, or it could be via the app, on the speak up function, which Dan just addressed. So that is, like we said, is available 24/7. You don't have to give your name if you don't want to. And a lot of people don't, to be honest. A lot of people do like to remain anonymous, and we help them that way. And we give them help and advice and support. And we've got really good feedback on that. So we can, from our monthly reports, we can see how many staff have registered that month. And then we can also see from when we actually started back in May 2024 as well. So we currently have about 1,240 people at the moment, but that goes up every single day. We are out there pushing and advertising every month, and we do see an influx of people signing up when we do that. But we also attend many different team meetings throughout the trust. As you can imagine, there's a lot of different meetings. There's frontline meetings, there's the back office meetings, and we're doing a roadshow now to capture those people that are harder to capture. So those people that are out on the front line servicing our patients, who wouldn't necessarily read so many emails or advertisements that come through. So we're drilling down to those people to let them know that we've got a really good service and it's available to them 24/7. This also captures, our people that are working shifts as well. So we're going in at different times of the day, that kind of thing, just to help and speak to those people. Thank you. Next slide, Dan. So the story behind the numbers, it is all about prevention. So we have prevention meetings that are put in place, and we often have some daily, 2 or 3 daily, in some cases, to help those people. So they might have reported something to their manager that they're really, really struggling, and then the onus is on that manager to get help, and we would like to support that manager because we don't want them to feel on their own. So we've done prevention meetings and we've wrapped around support around that team. And, again, the feedback's been phenomenal on those as well. We've also had, we deal with homelessness as well, financial help, like Dan said, physical, mental health, wellbeing, and all that kind of thing. So Our early warning data and allows us to react and help and support those people that are suffering. Thank you. These are just some insights into what we cover. As you can see, we as Deb's mentioned, we've got 6 counties. It's huge, absolutely huge. So we support on all mental, physical, financial, social, and career well-being. There's some examples there of some areas that we've helped to alleviate the stress for. So I'll let you read those at your own time, but it's ongoing, absolutely ongoing. It's every day, and we're really lucky to be able to support with our great colleagues at Hapstar going forward. And then with our staff champions we have. So we have over 750, 800 staff champions now in all different areas. And we talk to them all the time. We have monthly support meetings for them. And we talk about Time for Me and Hapstar to them, and they pushing it out to all their people as well, and being able to support them and give them regular feedback, anything new that's coming in, we push through that platform as well. And they are our eyes and ears around EEAST because we are so big. We obviously can't do it all the time ourselves, but they're helping us, and they report back to us on things that people might want to see that's not in the platform. So we work really hard with the Hapstar guys there to pull in something else. Somebody's noticed we haven't got this on the platform. Can we integrate that? And they always say yes. They're absolutely marvelous. So we're tailoring it all the time, and we're supporting all our staff champions throughout EEAST to do that. So thank you. I'll pass back to Dan. Thank you.
Yeah, cheers, Heather. So as you guys can probably tell, it's been a busy couple of years, and there's been lots of different elements to this project to try and build a really kind of holistic and rounded approach to supporting staff at the trust. But yeah, the project kind of doesn't stop there. We're doubling down for the next kind of year to 18 months, I suppose. So I just want to talk about some of the really exciting things that we've kind of got on the horizon. So we're working with the team at EEAST to build out a new digital trauma management process, which is going to be called Thrive, which is about helping members of staff that are being exposed to a potential traumatic incident and helping them reflect on that and understand that, and then making sure, based on their kind of risk level, that we can get them the right support. And yeah, that's a project that we're going to be working together on with various partners in the kind of the beginning of 2026. We're also looking at using ethical AI to be able to help triage people. So rather than providing kind of advice and guidance, that's about helping people to reflect and understand where they might need support. So then that coach can then signpost them to the right support and guidance that's available within the platform. We're developing a community forum, so a way for people to connect with others that have potentially got lived experience or have been through similar challenges, so people can feel that connection and that they're not alone. And then right now, really, we're on a project to kind of build out and develop the management level reports that are available for the trust. So being able to kind of go a step further when it comes to reporting on those key wellbeing indicators of burnout and stress and resilience. So hopefully the leadership team at EEAST can get that kind of finger on the pulse of these challenges. So yeah, I think back to Debs to kind of summarize, and then we're done.
Thank you. I mean, my gosh, doesn't this app do a lot? It's invaluable to me as lead. Those monthly reports telling us people might be struggling with conflict anxiety, where they're seeing those awful pictures of Gaza on the news, or Ukraine or Israel or whatever it might be, that are really affecting people who can't sleep. And that allows us to do those sessions in those areas and support those people. I don't want to sound dramatic, but this app has saved lives within EEAST. We have had people who have contacted us who have suicide ideation, and we've put in urgent and instant support for those people. And I've had members of staff come up to me and say, I wouldn't be here if it wasn't for you. And my goodness, how do you measure that? I think we'd now be lost without this support. I don't know any other way, because sickness absence doesn't measure health and well-being. Yearly surveys don't measure health and well-being. And how else do you do this kind of targeted assessment on such a regular basis, allowing us to use what resource we have? And we all know that we're struggling with reduced resource with regard to health and well-being. But it allows us to use the resource that we have in the most effective and the best way. So for us, this really works, and I could see this, being a huge advantage to so many organisations. But yeah, thank you very much for letting us talk to you today, and that's it with regards to our presentation, but we're happy to take any questions that anyone has. And of course, we will share the slides for anyone who'd like to have the slides.
Thank you.
Yeah.
Thank you, Debs and colleagues. Thank you ever so much for that really, really interesting presentation. So if anybody's got any questions that they want to add into the chat that you haven't already, please do that now, or equally feel free to unmute and ask a question live. Sandra, are you going to go first?
Yeah, I was coming online to yeah, thank you. Really interesting presentation. So I work for a county council and sort of lead on elements connected to wellbeing. So it really sort of struck a chord, Deborah, for me. I think so. We've got an EAP platform that some of this, in terms of the risk, where people can do the self-assessments and they can kind of look at their risk indicators. So we do provide that tool for our employees, but I think the big thing that's coming through for me here is those users have registered on the platforms, you get the information, you're getting the data on a regular basis. So that's actually what helps give you those headlines. Whereas I get a monthly report from my EAP provider that will tell me how many calls have been made, how many times have people accessed the resources on the website, but I don't actually have anything that says who, what, when, or where, really. And that's that bit about you actually being able to dive in and kind of really make it count, isn't it? I think, really.
Yeah, I think that's true. We do have a kind of EAP as well in the ambulance staff charity Task, who offer counselling for our people, and we get those kind of metrics from them too. But I think the app goes so much further, because firstly, it's preventative.
Yeah.
Our people can do, and they do so many hours of learning, and that's something that's really shocked me. They really have taken advantage of the learning modules in the app. So it's that prevention, and where we see some people who really rely on therapies and keep asking for extensions of therapies, and when people have had sort of 12, 15 sessions of therapy, what that says is therapy isn't working.
Yeah.
So we're really trying to break that cycle and focus on prevention and building mental fitness. And I think the other thing is the speak up function, because this process of allowing people to ask for help anonymously, and just to say that we have governance around that, so that if we do think someone is at real harm if they speak up, we do have a documented process which involves our Caldecott guardians, where we can audit trail back and find out who that person is. And we've only ever had to do that once so far. But I think having that way that people can ask for help in a way that they don't have to identify themselves is also invaluable. It's the reports, the learning, the prevention side of it, and
that function.
Yeah.
Who offers that support then to those that step forward and ask for that help then? Are you clinically trained in terms of being counsellors and psychologists, and are you sort of therapeutic practitioners in that sense?
Yeah. So within our team, we are mental health first aiders, we are TRIM
Oh,
practitioners,
yep.
we are wellbeing champions. I'm a health and wellbeing conversation trainer, and I'm also a menopause trainer. But in health and wellbeing, it's our occupational health department that have the clinical structure. So we don't have the clinical structure, but what we do is we will advise people where they can go for whatever help it is that they need. So we do provide talking therapies within the trust by qualified therapists. We also can signpost to specialist PTSD therapies. And actually, as part of the Thrive programme, Hapstar do have their own kind of EAP service, which we've just gained some funding for via NHS charities. So Hapstar actually do have their own kind of clinical type support as well. And we are going to be commissioning some of that because they provide such a wide scope of support, not just therapies, but career coaching and lots of different things as well. So we're going to be moving to that as well.
No, thank you. Yeah, really, it struck a chord and made me really curious. So yeah, thank you. Yeah.
And happy to obviously meet up and discuss with
Yeah,
anyone who'd like
yeah,
to.
yeah, no, that would be lovely. Thank you, Deborah. I really appreciate it.
Great. So we've had one of our live participants had to leave, unfortunately, but said that she really enjoyed today's session, found it very thought-provoking. I had a question, if that's okay. I was curious to find out how you built trust, because looking at the different areas that you explore, obviously it's great how holistic the app is, but it also requires quite a level of openness from people, and people are naturally they have a natural level of skepticism, don't they, about how anonymous their data really is and how open they can be. So I was really interested in how you found take up initially, and how you mentioned that you do various things to increase take up, but tell me a bit about how, I'd love to know more about, if you don't mind, about how you built people's trust in sharing that kind of information about stuff that is traditionally quite confidential to people.
Yeah, and again, I think that's the huge value of that confidential speak up. But as Heather says, we have a network of over 700 staff champions. So what we did was we trialed the application with them first of all and gained their feedback. So that was our pilot. It's really important to us, and I think that's why we only break that confidentiality when we feel that we absolutely have to. We have a risk assessment around whether we should break that confidentiality, because confidentiality for this application, as you've alluded to, Julia, is so important. We don't collect data on individuals. We only collect themes with regard to areas. So I think for me, it was piloting it with the staff champions. And as Heather says, they are spread across the organisation. They're our eyes and ears. It was reassuring them that everything is confidential. However, reassuring about the governance processes. And they were, because however good your comms is, it's really difficult to, especially when you've got people who work out on the road all the time, they're not working at a desk, it's really hard to get that communication through. So to build that trust, we really used our staff champions, who are brilliant people, we meet with them monthly, to get that message out there that this product was available. So it was using our staff champions, trying to preserve the confidentiality in a safe and way that had a good governance structure, I think. Does that answer your question?
Yeah, just to add as well, I think
Yeah, go
you're
ahead.
absolutely right, Juliet, because the confidence is the most, people having trust in a process like this is vital, because really it all falls down without that, right? We're asking people to reflect and provide information on really personal things. So having everyone believing and buying into that it's secure and it's a safe environment is paramount. And yeah, there's no silver bullet to doing that. I think it's a combination of things, which is awareness, which Debs has been talking about, but also kind of in the technology that message is clear as well, that nobody at, let alone anyone at the trust, but nobody at Hapstar will ever know the individual's data and scores and profile. It's always aggregated at a team level or department, or so we can provide support across the organization. But it's so important on any project really, because if people don't feel comfortable and safe to engage with the platform, then we're not going to be able to build out that data picture, which is the kind of the ultimate goal, I suppose.
Yeah, and just another quick question. Do people have to answer questions about all those areas, or can they opt into different areas they're happy to share information about? How does that work?
Yeah, it's all optional. Yeah, so they're encouraged to do as much as possible, because then the technology can tailor the experience. But yeah, it's always what they feel comfortable going through. And then if they do just want to log in and click around and explore without providing any information, then that's optional as well. Yeah.
Great. So I don't want to put Claudia and Krupa on the on the spotlight to ask any questions, but I'll just sort of pause for a few moments to see if there are any more questions for anybody, or indeed Sandra, if you've got another question.
Am I allowed to ask what budget? Am I allowed to ask the cost of what the platform is? If I was wanting to, in terms of thinking about what investment have you had to sort of put into it to get it to this sort of point? Might you share that?
I think Dan probably should answer that one, but I think what I would say is, at a time when so many organisations are looking to rationalise their workforce, and probably teams like health and wellbeing teams are vulnerable.
Yeah.
I think that the app does provide a really cost-effective solution, I have to say. But I think I'll let Dan reply to that one.
I mean, I'm happy to share some stuff probably offline. It's probably if that's
Okay.
the right sign. Just
Okay.
because it's
Yeah.
there's a
It's just it's just just would be interested, because I think for me, like you say, it's about how it's that just it's that moment for people and having it all in one space. And even, do they access the speak up through the actual sort of app as well? Do they sort of, you all in one space? And I think that's what makes a bit of the difference for people, especially like you say, with the frontline workers that are out and about. They can't, they don't want to go and have to look at an email or a notice board or log on to a staff intranet site or something to have a look for. It's having it all
Exactly.
in one place, isn't it? And I
It
think,
really is. I mean,
yeah.
and our information about our staff champions, our trim practitioners, as I say, our mental health first aiders,
Yep.
all of them, we have lots of different types. They're actually, that's all within the app as well.
Yeah.
So if they need to, if someone needs to speak to a menopause mentor, then they can look one up within the app who's local to them that they can talk to. So it really is our kind of one-stop shop.
Yeah, can see where that I can see the big benefit in that, because that's one of the things that we hear all the time. Couple of clicks and they're done. If they've not found it in a couple of clicks, then people are walking away, sort of thing, really.
Exactly. And the fact that people can have it on their personal mobile phones as well. It's not just on trust laptops and iPads. They can have it on their phones. I think that's helped us to reach people as well, because sometimes as well, if you've got people who are going through an ER process, and they're not in the workplace, and that's a really stressful time, they've still got their mobile phone, for example.
yeah, and they're still able to access that support, isn't it? And like you say, I think the anonymity is really key, isn't it? Because that is what people get concerned about in terms of letting you have any data. So yeah, it reassuring, Dan, that it's aggregated at sort of team level, so that because people do worry about those sorts of things. They think it's going to be used against them, or it's going to be shared or leaked. There's a lot there, isn't there?
Absolutely, and especially in the ambulance service, because people are afraid to say that they've got sort of problems with their mental health because they're frightened they're going to lose their license to practice.
Yeah,
So it's a particular issue for us,
yeah.
and that's where, you know, that's really helped.
Yeah, we're getting more and more. I mean, even as council employees, more and more incidents of violence and aggression
Yeah.
towards, and I know, and you don't have to travel too far to read of incidents with emergency services, but it's becoming everyday life even for people that work in a county council space where they're accessible. Even elected members are, they get accosted, and the people that have voted them in to be a councillor then give them a piece of their mind. So it's everywhere now, isn't it? I think really.
It is, and I used to be strategic lead for health, wellbeing and retention for Suffolk and North East Essex integrated care system. So I used to work closely with the councils as well. And a lot of the issues that I dealt with there would really be solved with
Yeah.
this application, I have to say. And it also, as I said, I think the important thing as well that Dan brought up was it fits with some of our other
Yeah.
initiatives. One thing that we have is a health and wellbeing passport, which is for everyone.
Yeah.
And that's encouraging and facilitating health and wellbeing proactive conversations.
Yeah.
And it helps our managers to have a resource to go to signpost people to, because obviously absolutely anything can come up in those conversations. So I think it really supports our management as well.
Yeah, at a time when that's needed hugely as well, for all of the reasons that you've already said. Yeah, I would be really interested in a conversation offline, Deborah, in terms of that. So if I put my email in the chat, I'll shut up now in case anyone else wants to ask something.
No, I really appreciate your questions and your interest,
Yeah,
Sandra.
yeah.
Thank you.
Hi, sorry, it's Claudia. I've got an issue with my laptop, so I can't put my camera on. So I apologise. I missed the beginning of the session. How many colleagues do you cover?
We have about 6,000 substantive employees.
Right, okay. Sorry, I'm from Islington Council. I just wondered, because one of the you talked a bit about kind of how you engage frontline workers, but I think for us, the biggest kind of barrier is kind of digital skills and kind of having that, I suppose, confidence to use an app. And I think potentially some of that is some of the systems we currently have aren't particularly, they were put in before, I suppose, mobile technology developed in some cases. So then things have developed and, they might go on, but they can't see a particular button and therefore it's not very user friendly to use. But I just wondered if there was kind of any wider plan in terms of the engagement side to kind of look at digital skills and kind of if you're doing any particular work around that.
I know that when I worked for the ICS, I did some work for example, kind of waste management types workforce, who had a lot of health and wellbeing issues, and I can understand what you're saying about using technology and kind of digital skills, for example, from that type, of workforce that we were so keen to support. What I will say is that because, and I'll let Dan come on this as well, but because the app is available on phones, I think that helps. It's not something that people have to go through a laptop to use. It's available on their phone. And I think for me, it's very intuitive. And it kind of prompts all the time. So for me, I think that makes it easier, and we have been able to come up with great guides for people to signpost them through using it. But Dan, I think you'd be best to come in on this one, because that's a really good question.
Yeah, I think you're absolutely right. It's always a challenge to make sure that the platform is as accessible as possible, and we've done a lot behind the scenes to make it easy to access for any, hopefully, for the majority of people, and also that the process and the language and the experience is as simple as possible, right? You don't need to be trained or read a guide to understand how to use the system. It should all be quite self-explanatory, although we have built out a lot of tools and resources to support and educate people on kind of what the platform is. But yeah, I think having it multi-device is really important. Some people much prefer accessing on an app on their phone. Others prefer sitting down on a laptop, so there's a bigger screen and they can kind of go through it in their own time as well. So having it compatible on any device, tablet, laptop, whatever it might be, is important. And truthfully, that's an area we're always looking to improve as well, right? That's why we try to make it as configurable as possible, because it's an area we want to just keep developing out. Obviously, it's always going to be a digital solution, but making it as user-friendly, as simple and as engaging as possible is kind of always front and center, because it's not designed to be for a certain demographic or a certain type of person. Again, to make the data as valuable as possible, it's really important that we engage as big a demographic of people from the trust as possible. And to do that, the platform has to be easy and accessible.
Thank you.
And when I say waste management staff, obviously what I mean is they're out on the road, just like our workforce. Some of our workforce are out on the road, so they're not sitting at a desk, for example. So sorry, that was the point I was trying to make there.
That makes sense, and it's that kind of when people access things, I think, as well. Yeah, making that as easy as possible. And then just final question was kind of, you talked about the workplace, you may have called it something different, but the workplace passport, is that kind of part of this system, or would that be something that could kind of be developed to kind of, if you've got your individual action plan, that can automatically go into any kind of workplace passport or plan that someone had in place?
So at the moment, our passport is separate to the app, but they work very well together. But I think as we move forward, we will try to integrate as much as we can into the app to make it, as Sandra was talking about, more of a one-stop shop for people, which just hugely simplifies signposting. But at the moment, our health and wellbeing passport, which is mandatory to be offered but not mandatory to be taken up, is separate to the app.
Thank you. That's really helpful.
No, thanks for the question.
Okay, so we've gone a bit over, which hopefully is okay with everybody, but it's been really, really interesting to hear about this app and the work that you've done. And like you said, Debs, what price can you put on, people's lives? So an incredibly valuable piece of work. And thank you ever so much for sharing your story. So thank you to East of England Ambulance, and thank you to Hapstar for taking part in today's session. And thank you for those of you who've been here live, who've added some extra dimensions for your brilliant questions. And we hope that everybody who is listening after today will get as much out of the session as we have. As was mentioned before, the slides will be circulated next week when Grace is back from leave, and also the recording too. And I'm sure colleagues who are presenting will be happy to be contacted as well for more details if you have any further questions. So one more time, thank you to the presenters for coming along, and thank you to those of you who've attended. And great to hear about it. And long may the success continue. Thanks, everybody.